There is this misnomer that the donor suffers more than the recipient.
Transplant surgeon Dr. Sanjay Kulkarni, who runs the Yale New Haven Health Center for Living Organ Donors, says there's a lot of misinformation out there. First thing to know about organ donation, he says technology has made surgery much easier on people who choose to donate a kidney or part of their liver. In the past, surgeons say they would have to cut a patient open in order to retrieve a kidney for donation. Now they say that's old school.
Now we do it total laparoscopically, so we do the operation through small incisions. That affords donors a lot less pain, quicker recovery time.
At number 2, another thing patients ask about.
Doctor, I heard that if I donate, I won't be able to get pregnant later on in life. That's completely untrue.
At 3, we've heard a lot about 3D printed livers and other organs.
To be able to manufacture organs like that with a 3D printer would be wonderful.
But Dr. Kulkarni says scientists are still years away from being able to make the layers of cells needed to grow vital organs from scratch. Another thing to know, if you donate an organ, if you need an organ later, you top the list.
In fact, let's say you donated your kidney and you actually need a liver transplant, you'd actually go to the top of the list in the region for a liver transplant.
And finally, number 5. Dr. Kulkarni says transplant patients like Gerardo Lambert, who got a new heart in 2009, the year his son was born, really do get a new lease on life.
These are really life-saving and life-lengthening procedures. Their longevity matches very closely what they would have if they never required a transplant.
We have more about organ donation on our website, news12.com. I'm 12 on Health reporter Gillian Neff, and that's your ultimate gift report.
My daughter was not quite a year old.
Dan Krause of Newtown was just 30 when he was hit with heart failure out of the blue.
I couldn't catch my breath.
Doctors say a virus caused a condition that had Krause's heart deteriorating. Doctors implanted a pump to keep it going.
It did about 80% of the work, and it came down and it came out my stomach that attached into this device.
But machinery only got him so far.
In 2016, things started to take a turn for the worse.
Doctors said he needed a donor heart, and that's when Krause found out the wait list is real.
The next organ that's available might not be the perfect match for the sickest person on the waiting list.
Donate Life Connecticut's Allison Keating welcomes the chance to explain what's real and what's fiction when it comes to organ donation.
Kidneys.
St. Luke's Children's.
People think that if I'm in an accident today, if something happens, that my medical care, they're not going to take care of me because I'm an organ donor and there's a shortage.
She assures us that EMTs and others trying to save your life do not concern themselves with whether or not you're an organ donor. Do you even know if they're an organ donor?
Most of the time not. Rush to pronounce dead is a fiction. We don't pull the plug on patients to donate their organs.
Bridgeport Hospital Emergency Room Dr. Rock Ferrigno says the rushing around you see on TV is real.
It is a highly choreographed, rapid response to deliver these incredibly needed organs in a safe and effective way.
With a cooler on a helicopter flying out to get it from a transplant team.
Things move fast, unless you're the one waiting.
It's awful to think of all the trouble that people go through while they wait for a donation.
Dan Krause can attest to that. He was sick enough to top the wait list, but waited 8 months for a match.
It felt like, it was pounding in my chest. It was pounding in my chest.
Within 6 months of the transplant, Krause was exactly where he wanted to be, on the slopes with his daughter. I'm 12 on Health reporter Gillian Neff, and that's your ultimate gift report.